blood supply is concerned. And we'll be looking at this by tackling the issue, looking at different success stories that have already happened, but also we'll put our eyes on a little bit of the challenges that we do face. And after that, we will hopefully try and figure out solutions going forward. This will be a very engaging session that we will allow for questions and comments. So do not shy to go to the chat box and send in your questions. Remember, if you want to contribute, remember to include your full names and the organization where you come from. It will be great to just restrict to one question at a time, and then we'll get a lot more chances to ask many other questions. Great. So to set the ball rolling, obviously the question of blood is one that is unending when you're looking at the African continent as far as health is concerned. And for a lot of people on this call, our interaction with blood donation was when, the blood donation drives came to schools and we were enticed by a soda and we went out there and donated. But when you look at studies all across, you realize there's a bigger need. We need to do a lot more in terms of mobilization to ensure that Africa is secure as far as blood is concerned. Whenever you're looking at maternal health, whenever you're looking at childhood anemia and basic use in the A&Es in different hospitals across the continent, we need to step up the conversation around blood. These efforts by many people who are on this call and organization elsewhere were hampered obviously by the effects of COVID-19. And our hope is that we will try to get back the ground that we lost by trying to get young people on board. And that is the purpose of this conversation this afternoon. But before we get into that, I'd like to do a little scene setter for you. If you could just train your eyes and watch this incredible personal story of Bola and why it is important that we reconsider the question of sustainable blood supply in Africa. Let's watch the video.
It's strange. I've had needles all my years of life, and I'm still scared of needles.
I've lived with sickle cell all my life.
Sickle cell disease is an inherited genetic disorder that affects people from birth. They start developing symptoms when they are 6 months of age, the commonest symptoms of which are pain and also propensity to catching serious infections. Patients who are affected have red cells that are sickle-shaped when they are deoxygenated, and this comes from the abnormal solubility of their abnormal hemoglobin. Sickle cell disease affects certain ethnic groups more frequently. The commonest are in Africa and also in people of Afro-Caribbean and Afro-American descent. It is a serious debilitating illness which requires lifelong treatment and a lot of support.
Hi, I'm here for my treatment.
A sickle cell disease pain crisis is undescribable. They ask you, what's your pain level? 10 out of 10. You go 12. It takes your breath, it takes everything. Pain keeps traveling all over your body. It's like something is pressing your heart down and your bones. I could be talking to you and then I could go straight into crisis, just that minute. You live every day not knowing what's going to happen.
The disease will always keep showing its face unless steps are taken to modify it.
Okay, thank you.
A patient with sickle cell disease will always feel tired, and there's always the threat that a painful crisis might come out of the blue. People lose their confidence, sometimes they are unable to attend school, and some people find it difficult to maintain stable employment.
As a young child, it was really hard. I really didn't have a lot of friends. I'm the third child of 5 from my family, but the only one with sickle cell. It means my parents had to dedicate their life looking after me. I gave up on relationship at some point, to be honest. By the time people find out that you have sickle cell, you just realize that they don't pick your calls anymore. But when my husband came along, there was something unique about him. We met at a bus stop. About 4 to 5 months into our friendship, I told Abby I had sickle cell.
When Bola did tell me that she suffered from sickle cell, I imagined that it was just something that could be easily treated or something that could be cured. But she insisted that I met with a sickle cell counselor, and that really enlightened me on the impact on sufferers and the families.
I was like, this guy does not know what he's getting himself into. He still went ahead. He still wanted to marry me, and he has been my rock. Growing up in Nigeria, the treatment I could have then was just blood transfusion and painkillers. That was it. Moving over to the United Kingdom, I was able to access more treatment. 3 years ago, I was close to dying. I had a serious chest infection. It was pneumonia. I was in ICU. Nothing was working for me again, nothing. And my consultant decided that, okay, Bola, we've tried everything. I'm going to put you through exchange blood transfusion. And I remember we just started to see the difference.
Automated exchange is offered for patients who have had strokes before, who've had recurrent chest syndromes before, and anybody else who's not doing too well on whatever treatment we're giving them. The automated exchanges are important because they give patients a much better quality of life. Some patients have been completely free of hospital admission since starting on the exchange transfusion program, which is a huge achievement.
Sharp scratch. Keep still for me. She's got a tricky vein there. The machine is able to separate what the doctors want to go in, what they don't want to go in. The treatment tends to last for about 4 to 5 hours. But after that, when everything is mixed up in my system, I'm good to go. Hospital used to be my second home without the mortgage. But now I don't have crisis. I have more energy. I'm here for my husband and my children. My parents look at me today and I just see joy.
This has been life-changing for her. Ever since we started this just over 3 years ago, she hasn't been to hospital admitted acutely since, which is a huge achievement, and she's been able to get on with her life and get on with her children.
She's more healthy. She's got more energy. The machine and all the support, the technology is great, but the blood, it's quite important.
Like sickle cell patients have got very different blood groups to those of the white population, who tend to be the majority of donors. So we're looking for ethnically matched donors to donate as much as possible.
This is why we're campaigning. This is why we're pushing for more Black people to give blood to support people with sickle cell disease. Having children, having my husband, I'm able to do what I love doing. My life has greatly improved.
Right. So, I mean, that was such a powerful depiction of what the efforts of the good people at COBA and the many organizations that are part of this are doing could do to individuals, because it's very easy to talk about the question of blood as a statistic, but when you put a face to it, when you put a person to it, then it becomes real. And our hope is that through this and many other stories, we're able to get encouraged to keep up with the efforts that we're doing. Right. I'd like to move this along. We will have 3 keynote speakers to speak to us today, and then we'll jump into a conversation with them. Our first speaker is Mr. Eddington Muchokwani, who is a blood donor management consultant at the National Blood Service of Zimbabwe. Eddington, welcome.
I think, Bonnie, we can move to the next speaker, as Eddington had some login issues.
Okay, we'll try to get reconnected to Eddington. So perhaps we could move to West Africa and speak to Dr. Andre Lua, who's the technical officer for Blood Safety World Health Organization, just to set the scene for us and give us an understanding of the situation from where he sits. Welcome, Dr. Andre.
Okay. Thank you, Mr. Chair. And thank you, Mr. Chair, and thank to the Coalition for Blood of Africa for the opportunity they give me to make contribution on the role of the youth in ensuring sustainable blood supply. Before talking about the core topic, I would like to make a brief overview on blood supply chain value, the current status and main challenges of blood supplies, and the impact of the lack of blood and blood product on health care in Africa. As you are aware, the blood supply value chain, which connect blood donors to blood recipients, consists of a sequence of direct links ensuring that blood is collected by blood transfusion services from selected blood donors at the blood collection site, either fixed posts or mobile stations. Blood components are tested for transfusion transmissive infection and blood group typing, processed and labeled, stored and distributed for transfusion to blood recipient in health facilities. All this process requires the implementation of the quality management system and a systematic assessment of blood product and services. Next slide, please. Next slide. A current status and main challenges of blood supply in the WHO African region from the last survey that we conducted indicate that for the availability of blood, the total number of blood donation and the average blood donation rate per 1,000 population are still low, almost 50% compared to the annual requirement, and only 8 countries in green on the map at the top right were collecting at least 10 blood units per 1,000 population as recommended by WHO. On the second map at the bottom left of the slide, 19 countries in also green on the map in the region have achieved the targets of the regional strategy for blood safety, which is at least 80% of blood donation should come from voluntary, non-remunerated donors. About the testing, the graph showed that despite the high prevalence of mandatory transfusion transmissive infection, all collected blood units were not yet tested at 100% in the region. Next slide, please. With regard to the impact of the lack of blood product on healthcare in Africa, the performance of critical services delivery programs such as reproductive and maternal health, child and adolescent health, malaria, HIV, hepatitis, non-communicable disease, tuberculosis, etc., can be compromised. Also, the progress on access to blood product can be lost because of the pandemic. Indeed, we conducted a quick survey on the impact of the COVID-19 pandemic on blood supply and demand in Africa. Overall, blood donation, blood drives, blood demand, and blood issues and transfuse dropped in the region with average percentage in bracket in blue column on the slide. These results were published and are accessible through the link indicated on the slide. Next slide. Next slide, please. Coming to the core topic, what could be the role of youth in ensuring sustainable blood supply? I am not going to describe all the expected role, but I will focus on the main. According to the WHO definition, young people cover the age range between 10 and 24 years. Almost 60% of African population is under the age of 25. We know that the young people are generally full of idealism and enthusiasm. As you are aware, the lower age limit for blood donation is 18 years or 16 to 70 years. In this case, with parental of guardian consent. Those under the legal age of blood donation should be educated earlier to become blood donors. In general, we know that young blood donors have a lowest prevalence of TTS. We know also that young people are the most important users of new communication technologies, including social network, website, and blog. And there are more and more applications that connect blood donors with nearby opportunities to donate in collaboration with blood bank. YARS can create club for recruitment of young blood donors and gain their commitment to donate regularly, such as Pledge of Club 25, originated in Zimbabwe. I think one of our colleagues, we talk about this. That they can also create peer education and promotion program that can help to promote safe and healthy lifestyles and risk behavior among the youth through regular blood donation. Young people can also contribute to promote and organize community and school blood donor sessions. As a government, public and private partners, international organizations, what we can do to support young people for their mobilization for the cause of blood donation. I think we need to encourage them to become regular, voluntary, non-remunerated blood donors through, first, providing support to youth-focused projects, including blood donation. Second, the introduction of blood donation as a noble gesture to save life in school programs. Third, an effective awareness and information to reach potential young blood donors. Fourth, providing support to youth blood donor association. And fifth, the recognition and awards for their contribution to the blood program. Another important support is the need of sustainable resources, both financial and human, from national government and also public and private partners in our international organizations to strengthen blood services for improving safe blood and blood supply. Next slide. We know that blood is life-saving product for vulnerable people such as mothers, children, victims of traumas and accidents, and emergency situations. Young people can contribute to health of these vulnerable people in the region through their regular blood donation. Thank you for your attention.
Thank you very much, Dr. Loa, for that very insightful take on the situation through the eyes of the WHO. And thank you also just for giving us context and a bit of practical ways that we can get young people into this. So from West Africa, we'll go to East Africa, and I'd like to invite Mr. Aaron Ogunde, who's a director at Damu Sasa, to give us his take of the issue. Karibu.
Thank you very much, Bonnie, and also thank you to the COBA team for this opportunity to actually share a few of my thoughts. Now, you can move to the next slide. So I thought it wise to first start looking at what we know, and what we know is that there's a rising demand burden for blood in Africa, and this is due to rising malaria cases, anemia, road carnage, and postpartum hemorrhage. In Kenya specifically, we actually need 1,500 plus units every day. The unfortunate bit is that we're currently dealing with a 30 to 38% supply rate on average. The limited supply is due to the following reasons in part, one of which is a weak blood donation culture. In 2018, according to a study by the BBC, was that 77% of the first people who donated did so for the first time. So this clearly shows you, and these were adults, so this clearly shows you of the culture, the weakness in the culture of regular donation. Then there's also limited resource allocation for blood services. This is in terms of staffing, this is in terms of screening equipment and reagents, this is in terms of blood banks, because we've had cases where people actually do show up to donate, but then you have no blood bags, which means they have to be turned away, which means lost opportunities in blood collection. Then we also have challenges in blood management systems. And as a result, despite the deficits we have, we still go ahead to lose 800 to 1,000 units due to either expiry or cold chain violations every quarter. This actually translates into lost or unmet transfusion outcomes. Then there's also lack of insurance coverage for blood services related treatment, which tends to make blood services quite costly. However, there has been a push, especially in Kenya that I know of, for blood to be included under the UHC. Next slide, please. So it's also important to understand the typical donor profile, especially given the fact that one of the challenges is in terms of collection. So there's who can donate, where you have, according to the WHO, according to the MOH, you have the 16 to 65, you have to have weight above 50, you have to be healthy. So there's all that. But then there's also now the need to look at, after all that, what's the typical donor like out of experience? So one is the fact that most of the people who actually do donate are aged between 16 to 38 years of age, who are actually the youth. And largely, most of these donors are related to a schooling institution, especially in Kenya, whereby either you will be affiliated to a secondary school or a higher institution of learning. Most of the people, especially based on the work that we do in transfusing facilities, come to donate for the first time as replacement donors, which actually means or can be translated or viewed as the fact that the first time somebody interacts with donation, it's out of coercion. And coercion here meaning that you've gone only because you had a relative or a friend in the hospital bed requiring a transfusion. And usually when your first experience with something is through coercion, it becomes very challenging to be told to actually now pick it up as something regular and voluntary. Then most of the donors are actually male, very great percentage. So it means that we actually need to do more work in terms of encouraging the female populations to actually come out and donate. Most donors reside in urban centers, which means we have also to do more work in terms of encouraging the rural populations to also go out and donate. Now, from our observations as well, we also need to look at the characteristics of the modern day donor and actually see whether we can meet them at what they feel that they want or like. First thing is appreciation and recognition. So you do realize that a simple thank you can go a long way in actually getting people to become regular donors. The modern day donor also wants convenience and comfort. I don't want to move from one end of the city to the other end just so I can donate. I need it to be, as close as possible and as comfortable as possible. We also want transparency, whereby you want to actually be able to see the entire process, not feel like there's anything untoward happening once you donate blood. And also, especially during the pandemic, we want to be in places where we feel like there's effective adherence to COVID-19 prevention, especially when we go out to donate. Next slide, please. Next slide, please. Yeah, role of the youth. Now, based on all the things that we know are happening and the typical characteristics of the donor, who are mostly the youth, one of the biggest roles out of the 5 that I felt were most important was to, 1, accept, own, and take responsibility of the problem, because I feel nothing can actually move unless the youth actually accept to take responsibility and in appreciating the contribution of blood services to saving lives. Number 2 is regular blood donation. So especially to the youth who may be on this call, just know that every time you can and don't donate, potentially 3 out of 5 mothers are facing death. And the other role that the youth can play is in terms of advocacy, whether it's advocacy to persuade more youth to appreciate the need for blood donation and participate in it, advocacy for improved resource allocation, in terms of staffing to make sure that there's enough staff to deal with all the donors who may decide to show up, enough testing capacity to make sure that all the blood that is donated can actually be screened on time to prevent such things as expiries because of limitations in testing capacity, to ensure that we have blood bags available so that no donor is turned away after they've spent their time and resources to come to the donation center. Advocacy for improved conditions, such as facilities for donation. So in most places, you'll find that the donor room is actually makeshift. In some cases, it's a very small room. So there needs to be improved conditions for donation. Then advocacy also in terms of policy and with respect to blood and universal health coverage. Then the other role that the youth can play is in terms of innovation. And this is new ideas using domain knowledge that can improve blood donations, whether it's change of culture, attitude. And by using domain knowledge, I actually mean that everyone has a role to play. Whether you're from the ICT industry, you could use your skill set to actually see whether you can solve problems. If you're from the legal field, you can actually see whether you can come up with legislature that can actually help change the way we view blood services. So everyone has a role to play regardless of the field or background that you have. Then also improve tools for managing and supporting blood services, especially in terms of the value chain, the chain of custody, to make sure that indeed the blood that finally ends up with the patient is safe for transfusion. Also, the youth need to take a very active role in policy discussions and negotiations, because most of these things that go through the different parliaments actually end up affecting them. For example, in Kenya, we have transfusion policy, which is a bill in our parliament that the youth really need to take a keen watch of. Next slide, please. So when I said that everybody has a role to play, regardless of the background that they're in, Damusasa is a youth-driven initiative, which is based on our background, our collective background of an ICT nature, where we used those skill sets to actually come up with a vein-to-vein blood services management platform that is built to facilitate collaborative access to safe blood and blood products for patients. Through that digitized support where facilities are able to conduct blood sourcing, donor relationship management, screening, inventory management, transfusion management, and even hemovigilance, real-time monitoring and evaluation of the entire blood services value chain, being able to then offer either corrective or preventive measures to make sure that patients can get blood when, and most importantly, where they need it. And we are currently offering this type of support in over 100 facilities in Kenya. Next slide, please. So potential areas for research in this in the field includes the entirety of the problem. So the factors causing the problem and respective implications, the actual impact of the problem on people's lives, like in the video that we have just watched. What is the impact on the patient? Like, for example, if I missed a blood transfusion, does that mean I have to stay longer in the hospital? And if I have to stay longer in the hospital waiting for a transfusion, does that mean the cost of my stay in the hospital goes higher? And if at all the cost goes higher, who pays for that cost and what's the impact on the economy? So there's such things that I feel we need to crystallize. Then there are also ways of then creating solutions by prioritizing the factors that have the highest relative impacts. So if we find that collection of blood has the highest impact, then how do we prioritize the solutions for collection? So those are the areas for research that I think should be undertaken. Thank you very much.
Thank you very much, Aaron, for your insight. And I think it is a great intersection of technology and medicine in trying to solve this problem. I have a few questions I'd like to pose to the panelists, and then once we have a good connection from Zimbabwe for Eddington, please alert me and we'll be able to include him in the conversation. But I'd like to pick up from a point that both speakers have mentioned, and that is the question of safety. And perhaps I could start with Dr. Lua. When you look at the African landscape when it comes to blood donation and the sustainability thereof, how are we doing in regards to safety, and what are the real practical ways we could take to ensure that we improve, especially on the question of safe handling of blood?
It's for me.
Yes, please.
Goes for, okay.
Yeah. Yes, please.
Yeah. Thank you so much. You know, I present the blood supply value chain, starting by blood donors to recipients. At all stages, we need to be sure that we are doing following the quality management system. The blood donor selection, we have the criteria to select blood donors. For the blood collection, we have also quality criteria for blood donation, the type of the blood bag, the volume of blood that we need to collect, etc. For the testing, in W-African region, the mandatory testing for infection is to test 100% for HIV, HBV, HCV, and syphilis. That are the mandatory infection that we need to. But also, we need to analyze for blood group. because if you don't have the blood group, there will be something that is not fun. And also for the storage, we need to store blood bank at a certain temperature between for red cell concentrated between 6 and 2 and 8 degrees.
Right.
If we want to distribute at the health facilities, we need to respect the storage condition during the transport and also during the storage at the health facility level. Even after the transfusion to recipient, we need also to do a surveillance. Like we talk about hemovigilance to see if there is no adverse reaction to the blood that we are transfusing.
Right.
We need to follow all the steps of quality system during the blood value evaluation. Over.
Dr. Lua, perhaps a follow-up question. Sorry to interrupt you, but I wanted to ask, now that there are all these protocols that are obviously prescribed by the WHO or the individual country health organizations, do you see finance as a challenge to attaining that? And what are the solutions to ensure that poor countries are still able to set up systems that will allow them to meet the highest quality in handling of blood?
Okay, thank you. You know, at the end of my presentation, I talk about sustainable funding for blood supply in Africa. During the survey that we conducted about the impact of COVID-19 on blood supply in Africa, we saw that in any country, even from government, there was not funding for blood supply in country, even during the COVID pandemic. The financial resource is the main challenges currently that blood services are facing. Right. Because all the reagents, consumable, equipment are very expensive and need sustainable resources to process this. We need, I think, at the end of my presentation, I talk about we need as a international organization, as a national government, as public and private partners, we need to strengthen really the capacity of national blood transfusion services to be able to provide safe blood to health facilities in the country. Thank you.
Thank you very much, Dr. Lua. I'd like to bring back Mr. Ogunde in this conversation. And Aaron, we spoke about that intersection of ICTs and how that enables us to sort of meet our goal. And I was just looking at, from where you see it, what are the emerging technologies that can be used in this part of the world to try and drive this? And if you could share a little bit about the practicability of some of these things, that would be great. And also if you could put your camera so that I get to see your face. Thank you.
Well, thank you very much, Bonnie. I didn't know I was going to show my face, but it's okay. Now, in terms of, like I said, people could use, domain knowledge. And in our case, we used the ICT skills that we had. Number one is that Africa is a very budding place for, technology interventions. First and foremost, because if you look at technology, whether from an internet penetration perspective whether you look at it from a mobile penetration perspective. So you also have to consider, in terms of practicability, the target audience. So we're looking at donors. Like I said, the modern day donor has a couple of characteristics, one of which is they're tech savvy. So you have to sort of bring in an angle in order for them to effectively participate. You need to bring in an angle that meets them at that turn of tech savvy. So the modern day donor would be on Facebook. The modern day donor would be on Twitter. The modern day donor would be on Instagram. So you need to also change your communication, using technology to actually meet them or rather go to them where they are. And that is why, if you take an example of the work that we do in Damusasa, is to try and bring these conveniences all at once, to the donor, whether it's by enabling them, book for donation appointments online, whether it's enabling them, make targeted appeals through our, Android application, whether it's enabling them to have, access, to their donation history straight on their phone, because we've had of cases where people do lose the donor cards, and also the need for appreciation and recognition, whereby for us, in our case as Damusasa, we made it possible such that people can actually, share their donation history on the various platforms, whether it's Facebook, whether it's WhatsApp, Twitter, and by so doing, not only get recognized by their peers for the fact that they've saved a life, but also in one way or the other encourage their peers to actually go out and do the same. So that is like the connection between, tech and the service and the space that we're currently in.
Right. Thanks, Aaron. And I'd like to, at this point, just shift gears a little bit and open up this conversation to all our guests on it, because, like we said, this is a big effort by different players to try and improve the situation that is blood donation on the continent. And I know there's a lot of people with experience of what has worked in their different jurisdictions would like to share with us. And so I'll very quickly like to open that up. How we'll do this is you could just put up your hand, and then I'll pick you up if you want to ask the question directly. If you want to write the question, I'm happy to read it off the chat box and be specific which of the panelists you'd want to address that. Okay, great. Who wants to go first? As we are looking for who goes first and which hand is up, to both my panelists, Dr. Loa and Mr. Ogunde, at the end of the day, there seems to be a big apathy towards blood donation on the continent. There's different efforts that countries are doing, that multi-agencies like COBA and efforts like people like Terumo are doing. However, we still see lack of interest, if I may call it that, in terms of donating blood. And I know, Mr. Ogunde, you've shared a lot of details of your research. But from where you sit, if you could pinpoint a major challenge for the apathy of donating blood in Africa amongst young people, what would that be?
Thank you very much, Bonnie. If I would point one of the greatest factors to that is if we were to look at it in terms of the work that has already been done, the work that continues to be done, and for the reason that we still have apathy, it means that there is something we have not yet understood how it works, and we probably need to go back to the drawing table and re-engineer various things. And that's why I was saying that one of the things we need to understand is how the modern day donor thinks, because the way a donor thinks today may not necessarily be the same way a donor thought a few years ago. And I've realized that most of the strategies that we still have are not up to date in terms of how the modern day donor thinks. That is why you will have a situation where you have an appeal on social media and somebody will just look at it and scroll down. like they saw nothing at all. So that is what I would pick out.
Right, thank you. First up, there's a hand by Mr. James Okello. James, if you could just unmute and shoot your question, please. Hello, James, are you there? Okay, as we wait for James, for the interest of time, I'd like to touch on two questions. Obviously, there's a first point by Esdras from Conakry, Guinea, who is talking about the technology and the fact that they have come up with an app that helps young people plug into this drive. There's also another point by Jean-Pierre Munyaneza, who says that drone supply of blood, where we store all blood components and supply them to health facilities where they're going to be used, and this has proven to be effective. Jean-Pierre, is this Rwanda, and are you able to just share in a matter of a few seconds exactly how this works? Jean-Pierre, are you there? Okay. I see another question from Estelle Tante, who says, Africa is so blessed with a large population of young people, most of who could be potential blood donors, yet we still suffer from unavailability of blood in most countries. What forms of non-remunerated motivation techniques or strategies can be used to bridge the gap in order to attain 100% voluntary donation? I think these are very good questions to Dr. Loa. There are many places that we still use motivation, different kinds of incentives, but how then do we help young people to plug onto this whole blood donation drive? If you could take that for us, Dr.
Okay, thank you very much. Thank you to Estelle. I already talked about some strategies to encourage young people to donate blood. But I think we need, Aaron talked about the new idea. I think we need now to do maybe a new survey with young people to know what they want about blood donation. It's very important. What is their motivation? What is their reluctance? If you know that, maybe you can develop a good program to encourage them. We know also in our countries, we need to promote at all levels, government, public services, at all levels, we need to promote good governance. Because if in a countries we saw that people are using money for other things, and for blood, they say that you need to donate on a voluntary basis. It's true, but we need at least to provide the resources that they want to, because organizing a blood donor recruitment or blood donor session need a lot of resources, but often they don't have. If they don't have, they will be discouraged by our own attitude. I think for me, other thing in our countries, often the public authorities give some recognition to someone who is very celeb for maybe for football, for basketball, for other things.
Right.
But it's also possible to give the same recognition to the young people who is the best blood donors in the countries. I think something like this will encourage others to become voluntary blood donors. There are so many things, but I cannot. It's not some. It is only some example.
Right. And I like what you said, Daktari, about the fact that it's not just about acknowledging the celebrities, but also looking at who are the best donors amongst ordinary people and acknowledging them as well. James Okello is ready to speak to us. James, please ask your question.
Good evening, all our panelists.
Good evening, James.
James, I work with the Uganda Blood Transfusion Service based at Nakasero. I've been keenly listening to the engagement here, but there are two key issues that I get so challenging when it comes to mobilization and sensitization of the potential donors, which happens to be the masses. Uganda is so privileged to have 80% of the population below the age of 35. So I would look at that as an opportunity where you can tap and recruit a bigger number of blood donors. But the challenge comes still back. It is a financing gap we have, because we have all the strategies that as I talk now in Uganda here, within a short period of 1 year, we have over 20,000 uploads.
Right.
Yes. So I would encourage within our network, within the forces of advocates of blood, creating blood, call out for partnership.
Right.
That can come and support say low development countries like Uganda to the same effect. Lastly, lastly, I would also implore benchmarking within countries of Africa, especially benchmark donor mobilization. And yes, it could give a better space to learning, practical learning, and practical engagement.
Correct. Thank you. Thank you, James. Thank you, James. I have to jump in for the interest of time, but thank you for very good points. On the first point on partnership, I think that door is very open. I mean, Dr. Amit and the good people at AHB and all the other partners are ready to have this conversation, because at the end of the day, we recognize this is a partnership. So I think that door is very wide open, and they're happy to engage with you in terms of how you can partner and try to support efforts in Uganda. Before we bring this to a landing, for the interest of time, there's one last question I wanted to put to Mr. Ogunde, and that is on the question of legislation. Are there low-hanging fruits when it comes to legislation that African governments can put in place to ensure that we move from a remuneration incentive-driven blood donation and build a team of regular donors or an army of regular donors on the continent? What can we do when it comes to our laws, Ogunde?
Thank you very much, Bonnie. So first and foremost is to accept the fact that the current laws are there, and yet we still have, the challenges that we do have. It then almost means that we may need to relook at some of them. And one of the things is to also look at, so I've spent some time considering other societies, how they do the blood collection. And in various cases, I've come across where blood donation is remunerated in some cases. However, in our case, specifically in Kenya, you'll find that it is non-remunerated. But if you check with remunerated populations, they seem to have a hold on things in terms of collection. So probably one of the things we may need to start looking at is, the different ways of incentivizing, including the remuneration aspect, whether as a continent we are ready for that. The other thing we need to look at is in terms of policy. How do we make, blood and blood services much more affordable, for the common person? Because if you were to look at, or if the video that we saw was anything to go by, you'll find that one of the best treatment scenarios for the sickle cell issue is the units obtained through the apheresis process. So the apheresis process is still new in Kenya. And I tend to think that as a result, you find that most of the units that come through the apheresis process are very, very costly. And that is why, in some cases, given the fact that blood and blood services may not yet still be reimbursable by the various insurances, you find that then the cost becomes beyond reach for patients. Now, the question is, does that mean that these patients, staring at death, especially given the fact that the blood itself was, donated in a voluntary manner? So those are some of the things that we need to look at in terms of legislation.
Thank you, Gunde. As we bring this to a landing, I'd just like to mention a couple of comments that I've seen on the chat box. Jean-Pierre Munyaneza says they're happy to share a lot more about how the drone works with anybody interested here. There's also Radolf Edem Galgo, who says that the modern day blood donor wants to be moved, to be educated, and to be encouraged to donate blood. Many might not know of this life-saving, thus urging the various authorities responsible to make more input in staffing as more blood donor recruiters who are IT inclined and can even get to potential donors online to educate them and recruit them to donate blood, which they believe that could aid in the increasing the number of voluntary non-remunerated. The non-remuneration issue seems to be a big concern and a big challenge to Africa. There's Talboys Nigel, who says that many of the issues discussed here are explored further in an online training program, and they've dropped a link there. And I think this is great because once we put together a lot of all these learnings, then we're able to move forward. Ladies and gentlemen on the call, for the past about 60 minutes, we've spent time trying to figure out how do we make it easier for African youth to be part of this journey of donating blood. And certainly we couldn't resolve all the issues in the 60 minutes we had. However, this is an open door for a lot more collaboration amongst the teams. Whether your organization is already plugged into COBA or not, I think this is a fantastic opportunity for you to plug in and see if we could borrow lessons from your jurisdiction, but also if you could also borrow learnings from the work that has already been done to try and drive this conversation forward, right? And just to finalize, I'd like to bring up Madam Pereira Kenana from Africa Practice to move a vote of thanks and close this session for us.
Thank you very much, Bonnie, for driving this conversation. And thank you very much for our panelists for making this conversation more insightful and exciting for all of us. We can all agree that we've benefited a lot from the discussions. I can see more questions coming in, more recommendations, more ideas on how we can work together to change the blood agenda in this continent. So this session was just the beginning of many to come. And one thing I've learned from this session is we all have a role to play. We all have a role to play to change the blood agenda in Africa. It's not just an individual responsibility. It's not just a government responsibility, but all of us in our different ways or the other have a role to play. And a few things that I've picked up that need to be addressed in order to change this, the blood agenda, and as well to encourage more young people to donate blood is we need to focus more on innovation. Dr. Gunde, Aaron mentioned a lot about thinking coming into the minds of the young blood donor today. We need to start rethinking. How are they thinking now? Is what we were using before working, and how can we bring in new innovative ideas in order to encourage more people to donate blood? Also, another thing I picked up is the importance of advocacy, education, and sensitization. It's one thing we need to invest a lot more to create awareness on the importance of blood in the continent. Also invest a lot in research. There are very many areas around blood that require research. And one area that Dr. Andre mentioned is it will be exciting to see a survey around young people to understand what exactly do they want in terms of blood. That dynamic would shift a lot of things in terms of decision making and encouraging more people, young people, to donate blood. Also, there was celebrate the donor, celebrate the ordinary donor, not just the celebrity. Bring in even the ordinary donor and celebrate them so that more people see the benefits of donating blood. And also policy was one area mentioned a lot. So there's need to come up with policies and regulations and legislations that safeguard blood donations across the continent. And last but not least, one thing I picked was we need to change our mindsets. So blood donation is important, and it's not just important when it affects you directly. It's important because there's a mother today who's suffering and requires blood, and we don't need to support her just when she asks for it. We need to develop the culture of regular blood donation. So thank you all very much for your time. As the Secretariat, we appreciate all your time and all your interactiveness and all your listening ears. We hope to do this a lot more often. We'd like to encourage you to reach out to us through the COBA email, which is coba@africapractice.com. For all those who'd like to partner, for all those who still have questions, please send your questions through our email, and we'll be able to respond to them appropriately. So thank you so much for your time.
Great, thank you everybody. Have a wonderful evening.